Coming to the chest pain. Any individual who comes with a chest pain, do not forget to get an ECG and trop I. Okay, ECG and trop I for every individual. Doesn't matter it's a pleuritic chest pain. Doesn't matter it doesn't sound. It sounds more like a costochondritis. Doesn't matter. First thing should come in your mind is ECG and trop I. It can be a myocardial infarction. But differentiating from a cardiac chest pain to a pleuritic chest pain is very important. Cardiac chest pain in a true sense, they do not have the pain, more of a heaviness they complain of. If someone is like sitting on my chest, I feel, doctor. Or if someone is like having a band around the chest and it's getting constricted, that kind of feeling I'm having. Along with this might be radiating to the left shoulder, to the jaw, that kind of features they'll be presenting with. If it's not an STEMI, if it's just an unstable angina or an angina, it might come down by giving an GTN spray. Approximately after 5 minutes or within 5 minutes it comes down, or on taking rest, it might come down. It will be usually associated with shortness of breath, sweating, profuse sweating. There will be nausea, vomiting. Those symptoms will be there, along with, in the past medical history, ask for risk factors. Diabetes, hypertension, hyperlipidemia, family history of cardiac diseases, smoking. Ask for all these risk factors. It is very important to cover up these risk factors. Do not forget to get an ECG and proper. Minimum for cardiac chest pain, do not forget. If it's an unstable angina, we call it as an unstable angina if it is a normal trop I, that is cardiac enzyme, and if it is a normal ECG, that means no ST segment elevation, then we call it as an unstable angina. Unstable angina is different from that of the NSTEMI. In NSTEMI, trop I will be elevated, then we call it as a non-ST segment elevation myocardial infarction. If ECG has an ST segment elevation, then we call it as an ST segment elevation myocardial infarction. If it's a STEMI, aspirin, angiography you need to give. If it's an unstable angina or STEMI, aspirin and fondaparinux, admit under cardiologist. Here, aspirin for STEMI, aspirin, and refer to cardiologist so that they can take up to the cath lab as soon as possible, that is within 120 minutes. Here, when you get an ECG done, they can give you an ECG and ask you to interpret what is this ECG suggestive of. Is it an ST segment elevation MI? Is it an anterior wall? It's a lateral wall. It's an anterior lateral wall. It's an inferior wall. Those things can be tested. Be aware of the ECGs. ECGs are heavily tested in the OSCE.